Now that I got your attention, let's talk about something very important in our healthcare system today. That is vaccination and the future of healthcare, presented to you by Brent Davis and Kendra Larson. In this PowerPoint, I will discuss the importance of vaccinations and the implications of healthcare due to not vaccinating. A brief history of vaccination. In 1796, Dr. Jenner first introduced the vaccine. At this time, smallpox was very prevalent in the United States, and Dr. Jenner inoculated an 8-year-old boy with cowpox virus, which is very similar to smallpox. The boy was able to develop immunity from the cowpox virus and was able to use that as defense against smallpox. Most vaccines nowadays are derived from the live, attenuated, or inactivated killed virus, which does frighten a few people. Although frightening to some, vaccines have been very useful in our healthcare system, as with vaccines, we've been able to eliminate or cure once prevalent diseases in the United States, such as polio and smallpox. Nowadays, since most vaccine preventable diseases are eliminated in the United States, the focus has shifted from the vaccine ability to cure diseases itself to the adverse side effects of a vaccine. Why we vaccinate? As I kind of described earlier, vaccines save lives. Vaccines prevent outbreaks of disease. When a majority of the people are vaccinated, it provides herd immunity, which help protect people who aren't vaccinated. Vaccination can save money on healthcare costs. Most vaccine preventable diseases cause lifelong disabilities. People are paying for medication costs and medications, and paying for a vaccine prevents any of these medical costs. Also, immunization provides protection against future illnesses for our future generations. Many parents choose not to vaccinate their children because of the harmful compounds found in vaccines, when in reality these compounds have no threat to the individual. For example, formaldehyde is actually present in our blood and is present in very, very minimal amounts in vaccines, and the amount in vaccines is much, much less than it is present in the blood in the body. The other one is ethyl mercury in vaccines. Ethyl mercury is easily cleared by the body, unlike mercury in seafood, which stays stored in your tissues for life. And then although there's been a lot of speculation that vaccines cause autism, there's no evidence or research that claims that vaccines cause autism. There are many major consequences for choosing not to vaccinate, and one of the major consequences is the introduction of outbreaks. There's been many outbreaks in the past couple of decades due to not vaccinating your children. For example, measles. Measles vaccine was introduced in 1972. Cases dropped from about 400,000 to 3,000 per year. But in 89 to 91, the average amount of measles rose to about 18,000 per year, and this was due to inadequate vaccination in inner city, and this was due to low knowledge of vaccine among these preschoolers and their children. In 2008, there was a mini outbreak in San Diego where a 7-year-old unvaccinated child came back from Switzerland with measles and infected 12 more unvaccinated children. This case was due to parents intentionally not vaccinating their child because of their thoughts of the adverse side effects. Whooping cough in Japan. In 1974, there was only 393 cases, and the vaccination rate was around 80%. By 1978, vaccinations dropped to about 10%, and there was about 13,000 cases in 78, and there's 41 deaths. And also the economic costs that come with an outbreak. In the San Diego case, mini outbreak case, there was $10,000 per patient of medical costs, and for patients that were too young to be vaccinated, had to be quarantined at a price of $7,000 or $775. Some more consequences for not vaccinating. Individuals who are not vaccinated are legally and medically responsible for their choice, which includes legal and medical fees if an unvaccinated person gets a vaccinated person sick with a vaccine-preventable disease. Also, there's extensive medical testing for people that are not vaccinated to determine illnesses. Also, there's the traveling issue with people that are unvaccinated and traveling to countries that have infectious diseases. Lastly, I want to touch base on the role of the pharmacist in vaccination. Nowadays, pharmacists have significant patient interaction, and patients feel comfortable to go to their pharmacist and seek for their medical opinion regarding vaccines and medications. Pharmacists can play an important role as educators and advocates for vaccines. With their technical background, pharmacists can inform people about their choice and the negative repercussions for not vaccinating, as well as the science behind the vaccine. Explain the benefits of a vaccination may help change people's minds and save them from future harm of acquiring the disease and expensive medical costs. It's good to remind your patients that for most of these vaccine-preventable diseases, there are no treatments. And the only way to treat them is to prevent them by vaccinating. I'd like to thank you guys for your time, and I will see you in class. Taylor, take it home. Shake it.